Welcome back. Did you know colorectal cancer is the third most common cancer diagnosed in both men and women every year?
Here with more on the importance of screenings is Dr. Jeffrey L. Van Epps with UT Physicians. Doctor, welcome to the show. Thanks so much for joining us.
Hi, Derek. Hi, Courtney. Thank you for having me.
Of course, this is Colon Cancer Awareness Month, and we're discussing this, of course, on the heels of such the passing of Chadwick Boseman. He was only 43 years old. When we put that age with what he battled at such a young age, I think it's alarming for a lot of people, and this is the message that you all want to get out, is that you need to get screened for this.
That's exactly right. Like you mentioned, colorectal cancer is the third leading cause of or diagnosed cancer in both men and women, but it's also the third leading cause of cancer death. And so roughly 5% of our population, or 1 in 20 people walking around, will be affected by this diagnosis sometime in their life, which is a staggering number. The value of screening is that, colorectal cancer at an early stage is not only highly treatable, it's actually preventable. So 2/3 of our cases of colorectal cancer could be prevented by adequate screening and surveillance regimens. But unfortunately, 1/3 of our population is not up to date with those regimens. And that has led to this rise in colorectal cancer in young people, and collectively has led the American Cancer Society to decrease their recommended screening age from 50 to 45. And that's just for average risk patients. But if you have family members who have had colorectal cancer at an early age or polyps, you may need to be screened even earlier.
It must be frustrating, Dr. Van Epps, for you, knowing that this is preventable, it's treatable. If the screenings are done and it's caught early, it literally can save someone's life. So why are people not getting screened? Is it because it's the part of the body that a lot of people are embarrassed even, mentioning to their doctor?
Yes, Derek, that's definitely part of it. It's not always the most comfortable thing to talk about. Some patients and some physicians honestly chalk up every anorectal condition or pathology to hemorrhoids. But the fact is, not all bleeding is benign. Much of it can be, but you need to be in tune with your body. And if these changes develop, changes in bowel habits, bleeding from your bottom, it's important not to sweep those under the rug or be too embarrassed to get yourself evaluated by a doctor.
Absolutely, and I think you have to go back to the point that you were talking about. If caught early, colorectal cancer is extremely preventable, it's treatable, but you have to pay attention to the symptoms that are going on. Pay attention to your bowel movements and notice. You're going to know when you're not feeling well, and I think if people pay attention to those gut feelings, no pun intended, right? Gut feeling, but really paying attention to those symptoms and getting in touch with your doctor can really save your life.
That's exactly right. There can be some more extreme symptoms of abdominal pain or new onset of weight loss without trying. But the fact is that most patients experience more subtle symptoms. And, it's very, very important to not let these changes go unrecognized or unevaluated.
And I think it's important to underscore that list of symptoms we just had on the screen, doctor, that doesn't always indicate that someone may have cancer, but it's a great reason, if you are experiencing those symptoms, to call your doctor to get checked just in case. Let's talk about, Dr. Van Epps, just treatment options for colon cancer. And I understand that this is really tailored for every patient depending on the severity or stage of that cancer, if it is diagnosed.
That's right. We do tailor our treatment regimens to each individual patient. That usually is dictated by the stage of their cancer, whether the cancer is original or whether it's a recurrence, and to the overall health of the patient as well. The three common tenets of colorectal treatment are surgery, that's where I come in, chemotherapy, and radiation, which is less commonly used for colon cancer, but more commonly used for rectal cancer. And there are some exciting new therapies that are coming down the pike that I imagine we'll see in the next 5 to 10 years. But for now, that's the primary way that we treat colorectal cancer.
And Doctor, I know that you mentioned this at the top of the interview, but if we can talk about the ages again, when we should be screened, and this is men and women, when we should be screened.
Yes, thank you, Courtney. So that has changed. It is no longer 50 years old for the average risk patient. It is now age 45 that you should get your initial screening colonoscopy. If you have a first-degree relative that has had colorectal cancer at an early age, or a family history of polyps even, then you very likely will need to be screened even earlier. And there are some more rare genetic syndromes that you need to begin screening at an even earlier age, but those are more rare. But so the point that everyone at home should take into account is, if you're age 45 and you haven't had a colonoscopy, please get one.
And again, if you're feeling embarrassed or uncomfortable, do not worry, you're not alone. And you, doctor, you see this every single day. we've got to leave it there, but thank you so much for your time in raising our awareness.
Thank you guys very much.
Thank you.
And if you would like more information or to schedule a consultation, you can visit utphysicians.com, or you can call 888-488-3627.
And we'll be right back with more Houston Life.